Hello, welcome to the Radiology, Economics, and Policy Learning Electronic Toolkit, Replete. I'm Meg Fleming from Emory University, and this session is the second of two add-on modules focusing specifically on nuclear radiology. This one focuses on reimbursement. This module is specifically targeted to address components of levels 3 and 4 of the Nuclear Radiology Milestones Project of the Accreditation Council for Graduate Medical Education and the American Board of Radiology. All of the other level requirements for nuclear radiology are addressed in various modules in levels 1 through 5 for diagnostic radiology. I encourage you to look closely at the RSNA's website to learn more about how modules map to different levels in different programs. The learning objectives for this module are as follows. Review reimbursement for nuclear radiology examinations and discuss special situations as they relate to reimbursement. Additional resources for this material are the American College of Radiology Nuclear Medicine Coding User's Guide and the American Medical Association's CPT book. First, let's review from other modules in the Replete curriculum. This is the payment chain, and each link in the chain must be intact from pre-authorization to valuation and payment in order for us to be reimbursed for our services. This module will focus on valuation for common nuclear radiology services. Let's remember that CPT stands for Current Procedural Terminology and tells us what service was rendered. In the first nuclear radiology module, we discussed coding for several nuclear radiology exams. Now, let's discuss reimbursement for those exams. Let's start with a bone scan. Remember that we chose the correct CPT code for the scan based on the extent of the body imaged. Here, we're looking at a whole body scan, which corresponds to CPT code 78306. And remember that when we code nuclear radiology studies, we always must include the code for the radiopharmaceutical too. So now, what may be reimbursed for this study? Before we look at the reimbursement for the bone scan, let's review where that information may be found. Remember from other lectures in the Replete series that we can use the Centers for Medicare and Medicaid Services, that is CMS's website, to search the physician fee schedule. And remember that radiology services are divided into the professional component and the technical component, which add to the total fee. Here is a single view chest radiograph as a reference. So now back to our bone scan. We can see the reimbursement for the whole body bone scan, which will be about $320. And then we code for the radiopharmaceutical. But wait, where's the reimbursement? It is important with all nuclear radiology procedures to submit a separate charge for the radiopharmaceuticals. It is important to report and charge separately for these items, even though they may not trigger additional payment from the procedure, since this charge data is used to set or determine current and future payments. Whether or not there is additional payment is based on the payer. Potential loss of this valuable charge data could jeopardize future appropriate payments for nuclear radiology. So, Even though it may not result in additional payment, we need to code for it to ensure appropriate reimbursement for our studies in the future. And how about the 3-phase bone scan? In the first nuclear radiology module, we learned that you cannot bill for both the 3-phase study and the whole body bone scan. So what is the reimbursement for the 3-phase study? Here it is approximately $365. Our next example is a PET CT. Here CPT code 78815 denotes the extent of this PET CT. But this result from the physician fee schedule looks a little bit different. We can see the technical component is missing. Let's then take a look at a different part of the Medicare physician fee schedule. The fee schedule amount has only a hospital outpatient prospective payment system, OPS, payment because these are typically performed in the hospital outpatient setting. Now we can see that the amount would be about $1,410. PET CT also has some nuances when it comes to coverage. For instance, in the chart, you can see that PET CT is covered as part of the initial treatment strategy for a number of malignancies, including colorectal, esophageal, head and neck cancer, and so on. But what about breast? The answer is, it depends. PET CT is not covered for the initial diagnosis and/or staging of axillary lymph nodes in breast cancer. However, it is covered for initial staging of metastatic disease for breast cancer. In other words, you do not need to get a PET CT to determine involvement of the axillary nodes in a patient with newly diagnosed breast cancer. Similarly, PET CT is not covered for initial staging of regional lymph nodes in melanoma, but using PET CT to look for more distant disease with melanoma would be covered. Now let's look at the variation in reimbursement among the different lung scans. For the ventilation and perfusion scan, or VQ scan, we look up code 78582. This would be a study to diagnose pulmonary embolism. So that's about $350. And let's compare that to 78597, which is the quantitative perfusion imaging. By contrast, the reimbursement for the quantitative perfusion study without the ventilation component is less, around $215. But what about a quantitative ventilation and perfusion scan for quantification of both pulmonary ventilation and quantification of pulmonary perfusion? For example, in patients with lung cancer and severe obstructive pulmonary disease, or evaluation before and after lung transplantation. Let's look up code 78598. The reimbursement for that exam is about $320. And once again, we need to remember to code for the radiopharmaceuticals. Several different ones can be used for lung scans, with a couple detailed here. While there is often no additional reimbursement, it should be included and coded. Next, we'll take a look at hepatobiliary imaging. Remember that 78226 is used when determining if a patient has acute cholecystitis. However, in the case of chronic cholecystitis or concern for biliary dyskinesia, where a gallbladder ejection fraction is reported, then code 78227 would be reported. For these two different hepatobiliary studies, we can see the difference in reimbursement. $350 for the one on the left that is used for acute cholecystitis, and about $475 for the one used to look at biliary dyskinesia and a gallbladder ejection fraction is calculated. As we've seen before, the radiopharmaceutical and/or other medications do not typically generate additional payment, but should be coded nonetheless. Last, we'll review reimbursement for a gallium scan. Remember that a whole body scan requiring 2 or more days of imaging is coded with CPT code 78804. If additional SPECT images are obtained, then code 78803 may be added. However, also remember that the addition of code 78803 does not mean both codes will be paid at 100%. Based on the Medicare multiple procedure policy, these codes are subject to the multiple procedure discount. Remember, that is, contractors pay 100% of the highest paying procedure on the claim, plus 50% of the applicable payment rate for the other covered procedure. So here we can see that the reimbursement amount for a gallium scan is about $600. And how much does SPECT, code 78803, add to the reimbursement? If SPECT images are obtained, the CPT code generates a fee of about $360. But remember, this one would be paid at 50%, so it would actually be about $180. Again, the radiopharmaceutical does not typically generate additional payment, but it should be coded nonetheless. Let's play a little matching game. In the left column, we have some of the nuclear radiology studies that we have reviewed. In the bottom right corner, we have some of the reimbursement amounts for those studies. So let's match them to the appropriate study. Okay, so starting with the 3-phase bone scan, how much was that reimbursement? How about $365? Next is the whole body bone scan. Remember, that one was less than the 3-phase study since it's really the last phase of the 3-phase bone scan. What is its reimbursement? How about $320? And now, what about the gallium scan? For 2 or more days of imaging, that reimbursement would be $600. So now the rest should be pretty easy. The reimbursement amount for hepatobiliary imaging for acute cholecystitis. How about $350? And what about the VQ lung scan for pulmonary embolism? Reimbursement should be about $350. So that leaves one, yes, the PET-CT, which has the largest reimbursement. Approximately $1,410. Thanks for playing. In summary, remember to code separately for the radiopharmaceutical or pharmaceuticals involved in an examination. While the radiopharmaceutical is coded separately, there may be no additional payment received. And remember that PET-CT can be used in the initial treatment strategy for a variety of malignancies. However, There are some exceptions where it will be covered. To ensure appropriate credit for this module, please make sure that you complete the accompanying online quiz from the RSNA's e-learning platform. More information on the REPLETE initiative and additional resources are available on the RSNA's website. I'm Meg Fleming from Emory University, and I look forward to helping you continue along your economics and health policy milestones journey. Again, thank you for participating in REPLETE.